This is the first video of the lower limb series. In this video, first I will introduce you to the osteology of the lumbar spine, pelvis and femur. After that, I will show you the axis of function at the hip joint. I will also introduce you to the musculature of the anterior compartment of the thigh, as well the medial and the posterior compartment with its innervation and attachments. During fetal life, the vertebral column as a whole is somewhat C-shaped, concave anteriorly. The thoracic and the sacral spine remains in the original curve in the adult life. However, the cervical and the lumbar spine change their curvature and become convex anteriorly. The cervical secondary curvature develops at the 3 months when the infant begins to hold up his head. The lumbar curvature develops when the infant begins to sit up straight, stands and walks. The pelvis is made of 3 bones, the ilium, ischium and the pubis. These 3 bones join to form the socket for the hip joint known as acetabulum. Remember that in the anatomical position, the anterior superior iliac spine or ASIS and the pubic symphysis are in the same vertical plane. On the ilium, we can see the anterior superior iliac spine, anterior inferior iliac spine, iliac crest, iliac tubercle, posterior superior iliac spine, and the posterior inferior iliac spine. This is the pubis. It is made of the body and the superior and inferior pubic rami. On the ischium, we can see the ischial tuberosity, ischial ramus, greater sciatic notch, lesser sciatic notch, and the ischial spine. The femur is the longest bone of the body. This is the proximal end of the femur. This is the head which fits inside the acetabulum cavity to form the hip joint. Here there is a fovea or pit where the ligament of the femoral head inserts. This is the neck, greater trochanter, lesser trochanter and intertrochanteric line. This is the shaft. Note its convex shape. On the posterior surface, we see the linea aspera. The thigh muscles attach here. This is the popliteal surface bordered by the supracondylar lines. This is the distal end. These are medial and lateral condyles. They articulate with tibia to form the knee joint. This is the intercondylar fossa that lies posteriorly, and the patellar surface, it lies anteriorly. There are 3 important angles associated with the femur. The femoral shaft lies more lateral at its proximal end and lies more medial at its distal end. This angle is called the angle of obliquity. The angle between the neck and the shaft is the angle of inclination. The angle between the long axis of the femoral neck and a line drawn through the centers of the distal condyle is called the angle of torsion or anteversion. The head of the femur inserts into the acetabulum to form the hip joint. This is acetabular labrum. It is a ring of fibrocartilaginous material which deepens the socket and keeps the head of the femur inside it. There are 4 ligaments that secure the hip joint: iliofemoral, pubofemoral, ischiofemoral, and transverse ligament. Usually only the iliofemoral ligament can be seen in the prosection. There is also a ligament to the head of the femur which carries an artery to the fovea of the femoral head. In the anterior compartment of the thigh, we see the sartorius muscle. Deep to it, we find the quadriceps femoris, which has 4 heads: rectus femoris straight on the femur, vastus medialis on the medial side, vastus intermedialis, vastus lateralis on the lateral side. All these muscles are innervated by the femoral nerve and they all extend the leg. The rectus femoris muscle crosses both the knee and the hip joints, so it also flexes the thigh. This is femoral triangle. There is a clinically important area on the anterior thigh called the femoral triangle. Its boundaries are the inguinal ligament superiorly, the adductor longus medially, and the sartorius laterally. It contains from lateral to medial the femoral nerve, femoral artery, femoral vein, and the lymph nodes. The contents of the abdomen can sometimes squeeze through the medial part of the femoral sheath known as the femoral ring. Since it is a weak spot on the anterior abdominal wall, the protrusion of the abdominal content through this ring is called the femoral hernia. In the medial compartment of the thigh, we find the pectineus muscle, adductor longus, adductor brevis, adductor magnus, and gracilis. Note that the adductor magnus is pierced by the femoral artery at the adductor hiatus. This is an opening in the lower part of this muscle. All of these muscles are supplied by the obturator nerve except the most posterior part of the adductor magnus, which receives innervation from sciatic nerve. The pectineus, it lies anteriorly and receives innervation from the femoral nerve. In fact, the adductor magnus has 2 functions. The sciatic nerve makes it extend the thigh, and the obturator nerve makes it adduct the thigh. This is the posterior compartment of the thigh. This is the biceps femoris. It has a long head and a short head. The short head does not cross the hip joint, and so it contributes only to leg flexion. The rest of the posterior thigh muscle flex the leg and extend the thigh. The other muscle group in the posterior thigh is known as the hamstrings. Here we see the semitendinosus. Notice its long tendinous part. This is semimembranosus. Notice how it flattens out into a membrane. The last hamstring is the part of the adductor magnus, which you remember from the medial compartment of the thigh. It is most posterior portion, acts to extend the thigh, and so it is called the hamstring part of the adductor magnus. This is the gluteal region. Most superficially is the large gluteus maximus muscle. It is innervated by the inferior gluteal nerve. This muscle is the major extensor of the thigh. Deeper to this muscle we see the gluteus medius muscle, and deeper is the gluteus minimus. These are innervated by superior gluteal nerve. Weakness of these muscles result in imbalanced walking, called the Trendelenburg gait. Deeper to the gluteal maximus, we see the short lateral rotator of the thigh. These are the piriformis, gemelli superior, tendon of obturator internus, gemelli inferior, and quadratus femoris. The piriform is an important landmark in this region. The superior gluteal vessels and nerves exit from the greater sciatic foramen above the piriformis, and the inferior gluteal vessels and nerves, as well the sciatic nerve, all exit from below the piriformis. So on this anterior aspect of the pelvis, I am going to demonstrate the obturator externus muscle. So here is the obturator externus muscle. This is also a lateral rotator of the hip joint, covering the obturator foramen. This is the iliacus muscle, and this is the psoas muscle. Together they form the iliopsoas and attach on the lesser trochanter. This is a powerful flexor of the thigh.